Guys, welcome back to another video. So if you're new here, welcome, and my good name is Nas Ann, and in today's video we are going to talk about endometriosis. A lot of people have been asking what is endometriosis. Can it cause infertility? Can it be treated? So we are going to look at all those things that you have been asking. So endometriosis is a painful condition that can impact your everyday life. When you have endometriosis, tissues similar to lining of the uterus grow in other places within your abdomen and pelvic areas. Endometriosis can cause painful and heavy period, as well as it can cause issues with infertility. So that is all about what is endometriosis, and it can cause issues with infertility, and also it can cause painful menstrual period. As I have said, endometriosis is it is a condition where tissue similar to the lining of the uterus grow on other parts of the body. When this tissue grow in the wrong places, it can cause you to experience uncomfortable symptoms that can impact your daily life. Some people with endometriosis also have have issues with getting pregnant. So endometrium is the similar lining of the uterus, and this tissue is that these tissues are the tissues that you shed every month when you are menstruating. So let's reason like this. Think of endometrium as a layer of tissue that build up along the inside lining of the uterus. When you have a period, this layer falls from the walls of the uterus and leave your body. If you get pregnant, the endometrium help to support the phases of development of the fetus. So when you have endometriosis, endometrial-like tissues grow on the other organ and the structures in the uterus. This tissue can grow within your abdomen, pelvic, and even in the chest. These tissues is hormonally sensitive and can become inflamed during your menstrual cycle. So these areas of endometrial-like tissue can cause ovarian cyst. If you have ovarian cyst, suspect endometriosis. Superficial lesion and deep nodules, adhesion, and scar tissue within the body. So a few places you can develop endometriosis include outside and back of the uterus, the fallopian tube, the ovaries, the vagina, the peritoneum, that is the lining of the abdomen and the pelvis, the bladder and the ureters, the intestine, the rectum, and the diaphragm. Those are the places where endometriosis can occur. They can occur anywhere inside the body. I've said the chest, the uterus, the diaphragm, everywhere. They can occur in any inside your body. The bladder, the abdomen, the peritoneum, the vagina, and mostly it's always occur in the reproductive areas. That is the vagina, the fallopian tube, the ovaries, the uterus, and others. So I know you are asking yourself, how serious is endometriosis? Endometriosis is a common condition that can interfere with your everyday lives. I will say that one as I continue most of my point. It can cause long-term pain, disruption to your menstrual cycle, and infertility issues. As we know that infertility is an issue, that someone, if you experience infertility, is always an issue, and it can bring a lot of problem apart from it alone. Then the symptoms of endometriosis that often sometimes they are manageable, and also they are also treatable. So who can get endometriosis? Any woman of reproductive age can get endometriosis. If I say reproductive age, I mean somebody from 15 years to 45 years, and most likely it's always happened from the age of 25 to 40 years. It can also happen to younger people, teenagers of 13, 14, but it is rare. So symptoms sometimes relieve when you are approaching menopause. When this discomfort, sometimes they can be relieved when you are doing, when you are approaching menopause, and sometimes when the endometriosis can go by itself without any surgery or treatment. So what are some of the risk factors for endometriosis? These are some of the risk factors that can place you at a higher risk of developing endometriosis. These factors can include family history of endometriosis. If you are somebody in your lineage has ever had endometriosis, you are likely to suffer from it. If your sister, your brother, your sister, your mom, your aunt, those are your lineage people, and if one of them has ever suffered from endometriosis, then you are at risk of getting endometriosis. Or the age you start having periods. People who begin menstruating before age of 11 may become may be at a higher risk of getting endometriosis. And also the length of your menstrual cycle. The shorter between periods and the duration of the flow, the higher the chances. Another risk factor is defect in your uterus or fallopian tube. If you have any problem with your uterus or fallopian tube, that is a defect in the development of the uterus and the fallopian tube, you can also have endometriosis. Another question that you are going to ask yourself, or most of you usually ask yourself, is endometriosis is genetic? Is endometriosis genetic? Although experts or scientists doesn't know the exact cause of endometriosis, they do see a connection between family history of the condition and increased risk of developing it at some point. So if you have as I have said that if you have somebody in your lineage that had suffered the condition, you are likely to suffer. So there is little connection with endometriosis. That is why they say there is some connection with it can be a genetic factor. So the next question we are going to answer: what causes endometriosis? The cause of endometriosis is unknown. When you have endometriosis, tissue similar to the lining of the uterus grow in the wrong places. When it develops in places like the outside of the uterus, fallopian tube, ovary, intestine, and within your pelvic cavity, it can cause painful symptoms. This pain is related to increased inflammation and often fibrosis and adhesions. So, what are the signs and symptoms of endometriosis? There are many signs or symptoms connected to endometriosis. The main symptom is pain, lower abdominal pain. The pain can be intense or mild. It can typically be felt in the abdomen, in the pelvic region, in the lower back. Although endometriosis is a common condition, not all people will experience the same symptoms. Sometimes you can have endometriosis and not know until it is found during another procedure or investigations. So people who usually do experience symptoms of endometriosis may have very painful menstrual cramp, abdominal pain or back pain during your periods or in between period, pain during sex, having bleeding during period or spotting or light spotting between period, infertility, having problem with becoming pregnant, painful bowel movement. Those are some of the symptoms that those who experience this signs will present with those signs. So there is no connection between the symptoms of endometriosis and the severity of the conditions. Some people may have very few patched endometriosis and still experience severe pain. Others other people might have severe endometriosis but not experience a great deal of pain. So, how is endometriosis diagnosed? In many cases, an endometriosis diagnosis will start with your symptoms. That is the first thing that the doctor or the healthcare provider will look into. So a painful and heavy period might cause you to reach out to your healthcare provider. Once at an appointment, your provider may start by asking you for your personal medical history and about any previous pregnancies and if any other person in your family had the same problem. The next thing that the doctor will do is a pelvic exam. If your healthcare provider need more information, they're likely to perform pelvic imaging starting with ultrasound depending on where the symptoms present. Physical exam is also very important, and ultrasound result will give the clear will give the right information. MRI may also be ordered for further endometriosis investigation. Laparoscopy may also be done, among other images. The doctor can decide which one they want to do to get the right information or to make the diagnosis out of it. So I know you are asking if it is treatable or what is the treatment from endometriosis. Your healthcare provider will help create your treatment plan for endometriosis based on a few factors, including the severity of the endometriosis, your plan for future pregnancy, your age, the severity of your symptoms, among others. Because when you are maybe approaching menopause, sometimes it always disappear. So your doctor maybe can prolong can relieve the symptoms, and then the doctor can you go for you come for supervision, and then the doctor will see if it can go by itself when you are approaching menopause. About the pregnancy, it will depend where the endometriosis is, because it causes inflammations. It can cause scar on the uterus, on the fallopian tube, and getting pregnant sometimes it can be difficult, and therefore the treatment also will depend on that. If you are somebody who still needs children, or you have already had enough children, then the treatment also will depend on that. In many cases, your treatment plan will focus primarily on managing the pain and improving fertility issues, not fertility issue, because most of the time that is the worry that as women we usually have. So some of the medications that are used to control the symptoms are the pain medications and the hormonal therapies. A hormonal option for suppressing the endometriosis can include birth control pills. You can use that to suppress the symptoms, and also you can use the pain management medications to suppress the symptoms. So if the symptoms does not disappear, or there is no improvement and the condition is putting you at risk of losing your life, then surgical option to treat endometriosis will be performed, and that is laparoscopy. That is laparoscopy. In this procedure, your surgeon will make a very small cut in your abdomen and insert a tiny tube-like tool called laparoscope into your body. This tool can be used to see inside of your body and identify endometriosis with higher definition camera. And by doing that, the doctor can remove the lesions. By doing that, the doctor can remove the lesions and that is how you will get treatment. The doctor can also decide to perform hysterectomy. In severe cases, your surgeon may suggest removing uterus based on the amount of endometriosis and the scar tissue present. If you have other uterine condition like endometriosis and your desire for future fertility has gone, the doctor can perform hysterectomy. That is the removing of the whole uterus or partial removing of the uterus. Sometimes endometriosis can go on its own. In some cases, endometriosis can go away on its own. Over time, endometriosis lesion can occasionally get smaller when you are approaching menopause, because you know it is an hormonal thing. It is hormones is the one that contributing to the growth of those tissues. So when you are approaching menopause, it can start reducing in size and the tissue can disappear. So if you are asking if it can go by its own, then your answer is yes, it can go by its own. Now, another question that we are also asking, what will happen if endometriosis is left untreated? Over time, endometrial-like tissue that grow outside your uterus can cause cysts. So you can have cysts, you can have adhesions, you can have scars. This can cause you experience a long-term chronic pain and you'll not be comfortable. You will have severe pain that you will not be comfortable most of the time. So if left untreated and the symptoms are not relieved, then you can have a chronic pain. So many people with endometriosis may also have difficulty in getting pregnant, as I have said earlier, and this is also a problem that should be solved. So another question that you are asking about, you always ask is, can endometriosis be prevented? Endometriosis is not a condition you can easily prevent or can necessarily be prevented. There are certain factors that can reduce your risk of developing the condition, but in many cases you may still have endometriosis. So there could be a genetic reason that some people develop endometriosis. If one people in the family is having it, then the other person can be diagnosed with it. Talk to your provider about your risk of developing endometriosis so that you know how it can be prevented. If you have a higher risk, like your family person is having endometriosis. So a few factors can reduce the risk, that is pregnancy, getting pregnant. Don't wait until you are too old, that's when you get pregnant. So getting pregnant can reduce the chances of getting endometriosis. Another factor is also breastfeeding. When you are breastfeeding and pregnancy, they control the hormones of fertility, and you know, of fertility, ovulation, and the ovulation and the menstrual cycle. So you see, the endometriosis is the tissue similar to the lining of the stomach is growing outside the uterus, and this is the things that are causing problem. So the pregnancy, and it is a hormonal thing, so the pregnancy can balance your body. Breastfeeding can also balance this hormone, or they can reduce this hormone. They can maintain the normal function of the body, and you will not get endometriosis. Pregnancy, breastfeeding, and also maintaining weight that is healthy for you. Don't become overweight. If you are overweight, also you can get at risk of getting endometriosis. Also, another thing that can also put you at risk of reducing, something that can reduce high chances of getting endometriosis is starting your menstrual period at a later age, and this one you cannot prevent. Everybody, they have how the body works by its own. So if you started your monthly period at a later age, then you have low chances of getting endometriosis. About the complication, yes, it can bring complication. There are several medical complications that can happen if you have endometriosis. People with endometriosis may experience fertility issue, that is getting difficult or getting difficult with becoming pregnant. This can sometimes be help with treatment option like medication, surgery for endometriosis, or fertility treatment like IVF. These people with endometriosis can also experience bowel and bladder issue. This may include pain with voiding or with bowel movement. If you experience that, you can also decide to see your doctor. They can also have problem with the kidney. You can occasionally get kidney swelling, or you can also usually get problem with the urinary tract infection. Endometriosis can occasionally also impact your lung or diaphragm. You see that the area that when we were looking at the area where endometriosis grow, we found that it can grow in the diaphragm. So you can have problem with your lungs, and shortness of breath can set in, chest pain, lung collapse, that one can also set in. Those are some of the complications that when you have endometriosis, it can bring to your life. So another question that I know you are asking yourself, can I get cancer from endometriosis? This is the answer. Endometriosis is associated with a small increased risk of developing epithelial ovarian cancer, mainly including clear cells and endometrioid carcinomas. This risk is extremely low and no preventive screening is currently recommended. You have a small percentage of developing ovarian cancer if you have endometriosis. It's not a must that if you have endometriosis you will develop cancer, but you have a smaller percentage that you can develop ovarian cancer. Another question, can you still have endometriosis after menopause? Menopause are times of a major change in your body. One thing that happened during this transition is a change in the level of hormones in your body, specifically estrogen. This link between reproductive hormones and endometriosis. After menopause, you have a decreased level of getting endometriosis. This can also mean that you no longer experience symptoms of the condition, so you have low chances of getting endometriosis after menopause. We have reached the end of the video. If you have watched this video up to the end, thank you very much. If you are new in this channel, kindly subscribe, like, share. You can comment if you like. You can also DM me on all my platforms. We have the same name. And also, just share our content, subscribe, watch. That is it. So thank you for watching this video. Bye till next time.